Hey, hope you're doing fine. My name is Usman Ghani. I'm a licensed physical therapist working in Toronto area, and welcome back to my YouTube channel, Muscle Tone Up with UG. This is a platform where you can find educational and informational videos on various muscle and joint issues. Our today's topic is very common one, acute low back pain. The low back pain that has just started recently as a result of some bending forward or trying to lift some weight. It might be as a result of some muscle or ligament strain in the low back. So these are the common activities that may initiate this kind of pain. Lifting any weight, or just trying to lift the furniture to shift it, or changing the setting of your own home, or even just bending forward to pick up anything from floor may result in this pain. So the pain is usually felt across the waistline area as shown in the picture. It may also go down to buttocks or behind the legs above knee. Common complaints are severe pain. One may also hear a popping sound while bending forward or coming back up. One is stuck in one posture and it's very hard and very painful to change the posture and positions and to move around. It may be felt as dull, achy, very tightness kind of pain constantly. However, the pain becomes very sharp on moving. For the step-by-step management, the first step is to provide rest to the injured tissues. It is recommended to avoid vigorous activity or exercises for next few days. So by that time, what we can do is try lying face down for some time during the day. You can apply icing on the low back. You can also take non-steroidal anti-inflammatory drugs for pain control. Then modified transfers in and out of the bed is very important. Some people may also experience a change in posture as a result of this pain. So I'll show you how and when to do the postural correction as well. Though we have to avoid any vigorous activity or exercises, but we need to start the gentle setting exercises in safe positions to initiate the muscle activity as soon as possible. For icing, lie down face down, put a paper towel on the low back and apply the cold pack on that. You might feel cold, very cold. If you start feeling numb or burning, take away the cold pack for a few seconds and then reapply it again. This way you can continue doing the icing for 15 to 20 minutes, 2 to 3 times a day. Keep checking and keep removing the cold pack every now and then to avoid any burns. As I mentioned earlier, it's very hard to achieve a restful position in this condition. So if you want to lie down on your back, you can add a couple of pillows under the knee. That would help to relax the muscles around the hip, around the low back and tummy. And for getting in and out of the bed, if you try getting out of the bed like this, it might be very painful and won't allow you to move. That position might be very painful as well. And a modified way is a log rolling, like the moving the whole body in one unit. You can do that by keeping the whole body straight or by bending the knee as well. Keep the knees together and then try to move the whole body to turn on one side as one unit. Once in this position, you can use one elbow and the other hand to lift the trunk up and at the same time bring the feet down the bed. Getting into the bed again, it's a reverse process. Use the elbow and the other hand to bring the trunk down and at the same time lift the feet, both feet together up on the bed. Once in this position, you can again turn the whole body as a one unit to achieve a restful position in the bed. Sometimes people may experience a shift of pelvis to one side after this problem, like this. And it is very hard to achieve the upright posture for next few days. After that, or once able to tolerate the standing position, we can correct this posture as well. So stand up close to the wall, opposite to the shifted pelvis, like this. Stand up few inches away from the wall, then lean with your elbow on the wall and put your other hand on the pelvis and try to gently oscillate the pelvis towards the wall. Keep repeating it for 10 times and keep repeating it until the posture of the pelvis is corrected and the pelvis comes in neutral position in next few days. For the gentle setting exercises, remember the exercises should be very light and in the pain-free range of motion. First exercise, lie down, try to bend your legs in a comfortable position, and then focus on your pelvis. Try to tilt the pelvis towards your tummy like this, in a pain-free range. It should be a gentle movement. Keep repeating it for 10 times, couple of times a day. That may help to initiate the muscle activity and muscle activation. For the next exercise, focus on your upper trunk and gently push your upper trunk into the bed surface. It should be very gentle one. Remember, we are just trying to activate the muscles. So the force should be very minimal of the maximal force. Hold it for a few seconds, keep repeating it 10 times, couple of times a day. For the next exercise, lie down like this, bend your one leg and straighten your other leg to push your heel very gently into the bed. Hold it there for 5 seconds. Keep repeating it for 10 times, couple of times a day, and perform it on each leg. If this position is not very tolerable, just keep both legs bent and squeeze both buttocks into each other. This exercise, bend your both legs, take a towel roll or a folded pillow and place it between the knees and very gently squeeze them together. Remember, all the exercises should be pain-free. We are just trying to activate the muscles. Keep repeating it for 10 times, couple of times a day. In 3 to 5 days or whenever able to tolerate, stand up like this with feet shoulder width apart. Support your hands on a surface in front of you. It should be high enough that it does not allow the bending of the trunk forward. And then just gently shift the weight on each pelvis. You can adjust the range of motion on both sides within the pain-free limits. It's just to mobilize the pelvis. Then stand up like this again, and this time it should be forward to backward direction. Move the pelvis in a very short range, which is pain-free. Keep doing it for 10 times, couple of times a day. Once able, try to give some gentle stretches. Pull the knee towards your chest a bit with your hands. Hold it for 10 to 15 seconds. If possible, try to stretch the knee towards the other shoulder. For example, the right knee towards left shoulder. Do the stretches for each leg for 10 to 15 seconds. Repeat. When able, try to pull your knee towards your chest very gently and hold it against your hands. Remember, this is again a setting exercise. Do not try to push too hard. Should be just 15 to 20% of maximal force or within pain-free range. When able, after about a week or so, try to lie down like this and try to lift your upper body on your elbows or forearms. Try not to go too far. Should be within pain-free limits. Keep repeating it for 10 times, couple of times a day. Try the exercises only in the pain-free limits. Keep repeating it 10 repetitions on each leg, couple of times a day. Try this stretch. Try to pull your each foot towards your bum with the help of the hand. It might be initially very tough and difficult due to the muscle tightness. You can also use a towel roll hooked around the foot and pull it with your hands. Hold it there for 10 to 15 seconds. Repeat a couple of times on each leg, twice a day. That might help to ease out the muscle tension. I hope it helps to take care of initial few days after the acute low back pain. These are the various topics I shall be covering in my future videos. If you want to get them, please consider subscribing the channel and press the bell icon to get the notifications in time. Give me a thumbs up if you like it. Don't forget to share it with family and friends, as sharing is caring. Stay tuned. Take care until next time.